start with a story. It's about a man that I met a few years ago. It was when we were transforming the Travelodge motel in Dartmouth into what is now the Overlook, which is a residence for 60 people who were chronically homeless before they were there. They are currently still actively using due to their mental health and addictions illnesses. And so I was in Victoria Park where there was an encampment. I met this gentleman there. He was sitting in front of his tent and he was very well educated, wanted to have a lot of great conversations with me. And then when he found out where I worked, he said, well, I want to live at the Overlook. So fast forward and he actually does live in the Overlook. And now this gentleman can be found every morning in the lobby, greeting the tenants, talking to them, giving them advice. And this is his home. And I actually call him the mayor of the Overlook. And it's much more than a nickname. It's really symbolic of the kind of community that the staff from the North End Community Health Centre who work at the Overlook have managed to create. It's a community that has brought people together to help them live healthier, more dignified lives. And a key to that is the transformation of not just a building, but into a community. So when I think about why we do the work that we do at the North End Community Health Centre, which can be messy and which can be very difficult, it's stories like that that remind me. You know, for over 50 years, we've been at the forefront of providing care to the most vulnerable in Halifax. And it's always been based on the primary care approach. But in recognizing the evolving needs of these communities over the last few years, we knew that we had to innovate. So that's why we turned to housing as a foundation for health, stability, and community. Housing isn't just a roof over someone's head, it's the start of a healthier, more dignified life. And you know, when you think about it, that just makes sense. But that's not happening everywhere. This approach is really just an extension of our deep commitment to comprehensive care. Transforming lives is really a way to go beyond just traditional health services. Let me share another story. A year ago this week, we had an incident at the Overlook. The Halifax Regional Police showed up in full riot gear and were looking for somebody, not one of our tenants, but somebody that they thought might be in the building. And they basically overtook the building for 11 hours. They didn't have a warrant, but they wanted to see all of our video, and anybody who was in the building couldn't leave, and anybody who had been out before this happened couldn't get in. So that meant that 60 vulnerable people, some were in, some were out, couldn't access their homes, couldn't walk their pets, couldn't get their medication, couldn't speak to their housing support workers. In fact, we actually got a bus from the city to come in so that we could have people get warm in the bus, and they wouldn't even let that bus up near the building. Just imagine if that had happened at a building in downtown Halifax. If that had happened at one of the nursing homes or in one of the long-term care facilities. It just wouldn't have happened. But it was because this community was not seen as valued the way they deserve to be seen and the way they deserve to be treated. So I tell you this story because it matters how you house people and it matters how you treat people. And that is the first foundation to having people get healthier. At the North End, we don't just provide housing, but we offer a place where people can reclaim their dignity. They're just not tenants, they're members of a community. And that's where a health journey starts. We're changing lives by challenging that status quo, by refusing to accept that our most vulnerable citizens should be treated with anything less than the dignity and respect that they deserve. When I talk about housing as a health innovation, I'm not just talking about the physical buildings. I'm talking about the choices we make in how we treat people. At the Overlook, as well as the other 15 buildings where we provide supportive housing, which supports about 200 people all in, we make that a home. But it also provides wraparound healthcare services, mental health and addiction supports. It provides stability. It's a community and a sense of belonging. And that's where true health begins. This resident came to the Overlook. He'd been chronically homeless, battling the cycle of homelessness, mental health and addictions issues. That was really all he knew. But when he moved into the Overlook, something began to happen. He had a stable place to live and the supports that were dedicated to him. And he started his journey towards health. And that didn't happen overnight, but over the course of the year, he gradually started to regain control of his life. Eventually, he was able to achieve something that is wonderful. He became sober. And this gentleman recently just moved out into his own apartment, no longer requiring our supports, still requiring supports, but not our supports. That's a wonderful story. And it's not a common story in our world, because to get to that takes so much work. And sometimes it's not that story for everybody. But it's a story that gives us hope. And it's a story that reminds us why this work is so vital. Housing is much more than a roof over someone's head. It's the foundation to recovery, to stability, and to transformation. And that looks different for everybody, but everybody should have a chance to find their journey towards that. We're disruptors by nature, and we want to disrupt the status quo and really try to make a change in how we approach health. Let's be clear. Housing is healthcare. Today, that may seem innovative, but we really look forward to the day that everybody realizes that it's the status quo. That's what it should be, the status quo. Without a safe, stable place to live, all other health interventions are undermined. How can you manage your diabetes or your health addiction or your mental health issues if you don't even know where you're going to put your head on a pillow that night, or if you're going to get a pillow? Housing is really the foundation to health. And it's not just an innovative approach, it's really a necessity, and it should be the bedrock on which everything else stands. This approach to housing doesn't just change lives, it helps alleviate the broader health crisis we're facing. When individuals have stable housing, we see fewer emergency room visits, fewer hospital stays, and less strain on our healthcare system. People are healthier, communities are stronger, and the cost of society is lower. It seems like it's a no-brainer, but that's not how we approach it. By providing housing as a health intervention, we're not just addressing homelessness, we're preventing the ripple effects that extend from beyond these individuals. We can't do it alone. Housing choices as a health innovation requires the efforts of the entire system. Citizens, government, private sector, not-for-profits like ourselves. It means looking at the issue of homelessness through a different lens, one that prioritizes removing barriers, one that prioritizes dignity, respect, and the basic human right of having a home. Imagine if as a society, we approach the housing crisis like we're approaching the health crisis. If every decision and policy was shaped by the understanding that housing is fundamental to a person's health and well-being, how differently would we address the issue? The challenges we face are huge, and we know that homelessness is not a new problem. We've been around for 52 years, and it's not going to be resolved overnight, and it may get worse before it gets better. But by reimagining housing as a critical health intervention and making choices that prioritize health and dignity and community, we're taking the first essential steps towards creating lasting change. At the North End Community Health Center, we've been doing this work for a very long time, and we intend to continue to make a difference for a very long time to come. But we need everybody's help to do it.